We have a second mayor, Yvonne Aki-Sawyerr from Freetown in Sierra Leone. She unfortunately had a death case in her the close circle of her collaborators. So she is right now attending a burial ceremony. We are with her mentally, and we are had the pleasure, however, to record her presentation this morning. So she's really sorry not being able to be with us, but we did our best to get the Zoom recording of her presentation.
My name is Yvonne Aki-Sawyerr, and I'm the Mayor of Freetown, the capital city of Sierra Leone. I'm really pleased to have the opportunity to share with you some thoughts here at the Basel Peace Forum, particularly on the impact of COVID and other health challenges on a city like Freetown. What does that mean for peace? It's important to recognize, first of all, that pandemics impact cities in a variety of ways. In the first wave, we saw very few cases. As late as December, just a month ago, we had still not gone past the 1,500 number of confirmed cases in the entire city, and we were at only 75 deaths. But that doesn't mean COVID wasn't hitting. COVID has hit us really hard because of the economic impact, the fact that we're part of a global village, the fact that supply chains were affected, the fact that the measures that were taken by the National Response Center affected inter-district travel, inter-district trade. So we saw in the first wave more of an economic crisis fueled by a health challenge. But in this second wave, we've already found ourselves in a situation just in the last 3 weeks where we've had more cases in 3 weeks than we had in 4 months of the outbreak in 2020. So we are yet to see how that will pan out. But what are our lessons learned so far? The first one is that cities are first responders. Irrespective of what might be going on at the national level, you at the city level have to deal with what is happening with your residents. How can they understand what this pandemic should mean or means to them? How can you support them in practical ways? Coping with the disease, but also with being able to implement some of the measures which are their acts to follow. And finally, how can you fill the gaps? Where are those spaces between what government says needs to happen and they need to do and what's actually going on? Leaders don't have the luxury of standing back and looking. We have to be involved because the residents are at our doorstep. So in our case, right as early as March, the 16th of March to be precise, almost 2 weeks before our first case was confirmed, we as a city had developed a plan, preparedness and response plan for COVID. It had 3 elements, and it has 3 elements because it's still ongoing. Number 1, behavior change messaging. Number 2, behavior change support. And number 3, isolation and quarantine support. What does it actually mean in practice? It means that we know that in a population where 35% of our residents live in informal settlements, also known as slums, where we have a high level of illiteracy, sometimes in some areas as high as 60%. It was really, really critical that we translated the message of what is COVID into a language that people could understand. And that's not just in terms of languages when you talk about different dialects. No, it's in terms of breaking it down so that people get it. So in order to do that, we worked with local influencers, chiefs, community leaders, youth leaders, religious leaders, really building on the lessons of the Ebola crisis, where I had the opportunity to play a role as director of planning for the response. So I understood that you saying something doesn't, and somebody listening doesn't mean they vetted. We had 480 teams going door to door across the city with this message. We had a horizontal approach, which meant walk.
Your picture slows down a little bit, but now they couldn't understand you anymore. So I stopped. I think if you can if you.
So we had vertical it was on 180
Zero.
So we engaged community, engaged the city, cross horizontally, working through the 48 wards of our city, led by the ward councillors, but also bringing on board these community influencers at the ward level in zonal meetings. We did this for 5 months. We also engaged vertically through special interest groups, whether it was the drivers union, the market association, the Indigenous Council, and indeed also the Ebola Survivor Association, really bringing together groups who could speak to and be listened to by more people in the community. We went a little bit more interesting as well, working with Idris Elba, his production company. We created a TV series, Bola and Rona. Ebola, short for Bola, Corona, short for Rona. And it was an animation, and they interacted, Bola telling Corona what he learned when he was leading the outbreak and what she should do to make sure she got us. So that was a way of people actually engaging on this, and then having obviously real life characters as well. So a mix. I also, as a mayor, did a series of speaking to Freetonians on Facebook Live in the early months of the outbreak, just listening and talking and interacting for 15 minutes every other day for a number of weeks. So that was some of what we did under behavior change messaging. Behavior change support, super, super important. In an outbreak where you're told the most important things you must do are wash your hands and socially distance, and you have a city with 35% of the people living in informal settlements, very, very crowded, overcrowded, poor housing conditions, where sometimes you have over 10 people in a room. How do you socially distance? And when 47% of your population don't have access to running water, how do you tell them, wash your hands regularly? So behavior change support was about addressing those. It was fast tracking some of the solutions which we were working on anyway under the Transform Freetown initiative, which is our city's 3-year plan. But it meant putting water harvesting systems into communities. It meant providing additional water tanks in community health clinics, at schools, and very importantly, in marketplaces, having market monitors within the market. We can't really socially distance. It's physically not possible. We tried, we couldn't do it. So instead, we have monitors who are in the market, ensuring the people are wearing face masks, ensuring the people are washing their hands because water is provided at the markets, ensuring that as best as possible, we prevent people from, sort of more interaction than is required. And on the point of face masks, we had the Mask Up Freetown campaign. We provided free of charge 140,000 masks, making sure we were targeting cheaters in the market, commercial drivers, as well as persons with disability. And we still continue to give out those masks free of charge. Those masks also meant that we were creating employment for our tailors because they were all locally made. And that's example. Other things we did with behavior change support was at the point where we felt that lockdowns may be a reality. As it happened, the economy could not cope. So we never actually had lockdowns in the way that other countries, other cities had them. The longest we had were 3 days, and we had them just twice. But at that point, at the beginning, we weren't sure. So we developed a plan, which we're glad we're implementing because it has more long-term value as well, of supporting urban farming. So we were able to select 300 women-led households, and we all know why women-led households. We know the vulnerability of women. We know the role they play in these sorts of situations, the burden that they carry. So 300 women-led households were provided with the tools and the technical support to start backyard gardens. And these women were particularly those living in informal settlements. So backyard isn't a grand thing. It just means you had enough space for us to provide you with a planting box and ensure that we're also supporting you with water supply. And these are, like I said, elements of the support, behavior change support. Moving on to our final of the three elements, quarantine and isolation support. People are being quarantined. They've been quarantined throughout this outbreak. When you're tested, when you're in contact with someone who's tested positive, you are quarantined. You are asked to stay home, and in some instances, the government will actually put soldiers in front of your property to ensure no one goes in or goes out. But how do you eat? The government is tasked with the responsibility that they took on to provide food. We found very early on that this wasn't happening on a regular basis. We agreed with them that they would do the first 14 days, and if there was an overspill beyond that, council would come in. What's happened in reality is that we are supporting quarantine homes, and that's really made a difference to enabling people to remain isolated. Going beyond that, we also opened an isolation center for 180 people, targeting those in informal settlements. So this is some of what we've done. What are the lessons in quick conclusion? The lessons that we have taken away is that community ownership continues to be key, but leadership is also central. Leadership will drive community ownership, where people see leaders saying one thing and doing another, particularly with respect to using face masks, maintaining social distance, limiting the interaction. It affects their response. We've seen that happen in this outbreak, and it's something that I'm sure others are experiencing, and it drives a wedge. From the perspective of inequality, we've also seen how badly the poor are hit, how those already vulnerable living in informal settlements are adversely, disproportionately impacted, not only by the outbreak, but also by the measures to curtail the outbreak. What does that tell us we need to do? More engagement, more support, more having the people affected at the heart of what is going on. A few reflections as we discuss peace at Basel today. Thank you very much.